Hello, this is Dr. Drew Hall from Los Angeles, Upper Cervical Health Care in Los Angeles. What I wanted to talk about today was chronic neck pain. Chronic pain actually affects 100 million Americans every year. And there's 300 million people in this country, so 1 out of 3 Americans suffers with chronic pain. And 15% of those people out of that 100 million suffer with chronic neck pain. So we have 15 million people in this country who every day suffer with some sort of pain in their neck. Now, most of those people swallow Advil and Excedrin, and if it's bad enough and they've gotten prescription medication, they're on hydrocodone and codeine and Percocet and some of the other medications. And I think most of us know that that is not a solution for neck pain. We're happy when we have chronic neck pain that we take those and it goes away, but it certainly doesn't fix what underlies that. So, and there are ergonomic considerations. I know a lot of people that suffer with chronic neck pain, they're in front of a computer all day, they sit all day, and there are certain things that you can do to help modify the way that you sit that can help relieve some of those problems, like putting your monitor at eye level and making sure that the small of your back has the normal curve in it, so you're sitting up straight and your elbows are resting on the chair armrest, so you're not recruiting all the muscles in the upper shoulder. But so we can do a lot of things that can help alleviate the neck pain, but I think everyone wants to know what causes it. And of course, there's no one cause for everything that exists out there, no disease, no symptom. But generally, by and large, chronic neck pain is caused by a neck injury prior to its onset. Whether that be a car accident, they were dropped upside down wrestling, they fell out of a cheerleading pyramid. And usually when the trauma happens, the person takes note and they go to bed that night and they don't think too much of it. And so what I'm getting at is most of us who have suffered with chronic pain is something that started slowly, it was insidious. We really have a hard time connecting where it came from. And so when you suffer an injury, whether, like I said, it's a car accident, or you fell off a cheerleading pyramid, or you dove off a diving board and hit your head on the bottom of the pool, those types of injuries actually destabilize the joints in the upper neck. And the reason the upper neck area is so important is, number one, it's where your brainstem sits, which is basically the seat of control for all of your body. But the reason this area is so easily injured is you have a 13-pound mass sitting on a 2-ounce bone. So you're carrying around basically a bowling ball and a 2-ounce bone that's held together by muscle and ligament. And of course, as we go through life, most of us have had some sort of trauma. Some of us more, some of us less. But most chronic neck pain sufferers are dealing with a vertebra in their upper neck that's out of its normal position, and it was caused by an injury in the past. And so when there's an injury and when the vertebra shifts out of position and the joint capsule and the ligaments and the muscles and all the soft tissue get injured, what happens is the muscles in the neck go into spasm. And because you have a structural misalignment in there, you have irritation to the spinal cord. And because your body's intelligent, what it does is it tries to adapt away from the injury. And so one of the most common things you'll see if you watch people walking down the street or you sit behind them in church, you'll notice that one head is off center, one shoulder is higher, sometimes they swing one arm across the body and not the other. But all these are signs that structurally the body is out of balance. So if you have chronic neck pain, what can you do about it? And we've kind of told you the most chronic neck pain is caused by some sort of injury that happened in the past, and the atlas becomes locked under the skull and the muscles go into spasm and the posture adapts. What can you do to change this? In our office, we do what's called upper cervical specific. The technique is BLAIR upper cervical specific. But throughout the country, there are hundreds of upper cervical doctors that are trained and specialize in determining whether one of your top 2 vertebrae have been injured in the past and whether they're in their normal position or not. And more importantly, if they're not in their normal position, how are they impacting the central nervous system? So if you were to go into one of our offices, you would be run through a set of objective scientific tests that determine whether your C1 or C2 is locked out of position. If it's determined that it is locked out of position, then a set of very precise upper neck x-rays are taken to look at how each individual joint has misaligned. So we know what direction you're off, we know how your joint anatomy is formed. And then once all that information is received, then we make what we call a precise spinal correction. Basically what that means is you're lying on your side, either left side up or right side up, and a very precise, gentle force is introduced into the vertebra to put it back under the body's control and to clear the nervous system of the pressure. There is no popping, there's no twisting, there's no pulling, it's painless. Most patients think after they're corrected we didn't do anything. And then once the correction is made, the patient is monitored over a period of time and they're checked with our objective tests. The upper cervical goal is to get you to stay in your normal position as long as possible. We want to adjust you as little as possible. Your body's what heals you, not the doctor, and it's not the more adjusting you get, the faster you're going to get better. But so once it's corrected, you'll come in for follow-up visits and we'll check to see whether you're clear or not. The longer you hold the adjustment, the faster you're going to get better, the less we're going to need to see of you. And it's our goal and our objective to stabilize you and to get you well and get you feeling better again and enjoying life. So thanks for listening. We'll have more of these videos coming out in the future.